this is observational translational research to evaluate efficacy of nivolumab for advanced gastric cancer. So we actually performed this deliver trial is a multi-center observational translational study which planned to enroll 500 patients with gastric G junction cancer and performance status 0 to 2 patient. So we wanted to see the real world data in clinical practice in gastric patient treated with nivolumab alone treatment. Also, we were focusing on finding a new biomarker in gut microbiome. So microbiome is a very promising factor to predict immunotherapy, actually which several data already published in other types of cancer. So this deliver trial primary endpoint was overall survival in clinical data. Also, for a biomarker study, we are collecting the feces and the blood samples at the 2 time point before and after nivolumab treatment for measuring host-related factors, including gut microbiome, genetic polymorphism, and metabolome. This result was will be presented in ESMO GI this year. So in this result indicated response rate was 6.7%. Also, disease control rate was 39.2%. Also, we were analyzing tumor growth rate. So tumor growth rate actually decreased after nivolumab treatment in 56.6% patient. Also, interestingly, about 20% patients were identified as experiencing hyperprognostic disease, which was defined as greater than or equal to twofold increase of the tumor growth rate before and after nivolumab as a hyperprognostic disease definition. The hyperprognostic disease rate was 9.6% in this study. These are really a first data of HPD rate using real-world data in gastric cancer patients treated with immunotherapy. Also, in clinical data, subgroup analysis indicated showed disease control rate was about 40% for performance status 0 and 1. But this control rate was a low rate, actually 24% for partial performance status 2. Also, this control rate was relatively lower in high neutrophil lymphocyte ratio group. Also, this control rate was lower in patients with ascites compared to patients without ascites, actually 28% versus 47%. We compared the clinical data between ATTRACTION-2, it's a phase 3 trial evaluated nivolumab versus placebo in previously heavily treated gastric cancer and the DELIVER trial. So response rate was actually 11.2% in ATTRACTION-2 trial, but our trial was 6.7%. Also, this control rate was about 40% in the ATTRACTION-2 trial. Our trial, it was a comparable rate. Also, preliminary data of survival time in this DELIVER trial showed median PFS was 1.8 months, and the median OS was 5.9 months. It's almost comparable to Attraction 2 trial. We will show preliminary toxicity in the first 200 patient cohort. Several common adverse events, such as diarrhea, fatigue, decreased appetite loss, were observed more frequently compared to the Attraction 2 trial. However, there were no unexpected immune-related adverse events in this DELIVER trial. In summary, this DELIVER trial showed real-world data indicated disease control rate was about 40%, and the response rate was 6.7%. Also, survival time would be comparable with the Attraction 2 phase 3 trial, but still immature data.